All right, so here we're going to look at the pelvic diaphragm, the muscles of the pelvic floor and the perineum. And then we're going to look at the levator ani, coccygeus, the urogenital diaphragm, which includes the superficial transversus perineal, bubospongius, ischio-cavernous, and the urethral sphincter. All right, so we have the superficial and deep transverse perineal muscles. These are paired muscles that travel transversely across the perineum to the anal sphincter. They surround the external urethral sphincter, and in women, they also surround the vaginal orifice. These support pelvic organs and help stabilize the perineum. So the levator ani can be broken down into the pubococcygeus and iliococcygeus. This is their broad sheet of muscles forming the majority of the pelvic floor. The pubococcygeus is runs anterior to posterior from the pubic bone to the coccyx. So this is where we get the name pubococcygeus. Iliococcygeus is going to travel a little bit more diagonally. So the coccygeus itself is the smallest and most posterior of the deep pelvic floor muscles, triangular in shape, and it travels laterally from the ischial spine to the coccyx and sacrum. So the ischio-cavernosus and bulbospongiosus. Ischio-cavernosus is paired cord-like muscles. They assist in maintaining erection of the penis, or in women, the clitoris. The origin is going to be on the ischial tuberosity, and the insertion is going to be on the tissue, the erectile tissue itself, which is the corpus cavernosa of the penis or the clitoris. All right, so on to the abdominal wall here. We're going to look at the iliacus and the psoas. So we have the psoas major, which is going to be the larger portion of the muscle, and then the psoas minor, which is a much smaller portion of the muscle. The iliacus and psoas pass under the inguinal ligament, and then they insert onto the femur. These two muscles are joined together into what we call the iliopsoas muscle in the thigh region, but you can see them very distinctly as individual muscles in the core of the abdomen. So the iliacus is somewhat triangular in appearance. It is on the upper thigh, just medial to the sartorius. It originates, however, on the iliac bone and travels under that inguinal ligament to the thigh. So it's going to have the origin here on the iliac crest and the iliac fossa. Insertion then is on the lesser trochanter of the femur. And so this is again going to be somewhat in the lower abdominal area, pubic area, behind those hip bones basically, okay, and then pass through on out to the thigh. The action is to flex the hip and assist somewhat in flexion of the trunk, which means bending forward. All right, so you can see the psoas major here in green, and I'm pointing to it on this endeavor, and you can see next to it the psoas minor, which is much, much smaller. It's medial to the iliacus in the thigh, and it's going to flex the thigh and assist in flexing the trunk and bending forward. All right, so here we have the pectineus. This is medial to the psoas or iliopsoas. It is a smaller triangular shaped muscle. It travels from the pubis to the lesser trochanter of the femur. The origin is going to be the superior pubis, and the insertion is going to be the posterior femur just below the lesser trochanter. The action is to flex or bend and adduct, which means pull medially the thigh. So here we have both the adductor longus and the adductor brevis. The adductor brevis is very tiny there. It is somewhat triangular in shape. The longus, it is going to be medial to the pectineus. The brevis is located just deep to the longus and is short, which is hence the word breve, between the longus and pectineus. They both are going to originate on the pubis near the pubic symphysis. The insertion is going to be the linea aspera on the femur there, and the brevis is going to insert just a little bit above or superior to the longus. The action is adduction of the thigh and assisting in flexion and medial rotation. All right, so here we have the tensor fascia latae. This is located on the lateral side of the thigh. Its tendon joins the deep fascia latae. The fascia lata, along with the tendons of the gluteus maximus and tensor fascia, form what we call the iliotibial tract, the IT band for short, which is a long band of fascia which runs down the lateral side of the from the thigh to the knee. So you can look for this attachment for the IT band to help identify. It's going to flex and adduct the thigh. If you look, let me get some color here. Over here, it doesn't look like that big of a muscle because they're only showing you the side view. But if you look here, I've got it pulled forward some and you can see it's really quite a large muscle. So here we have a good overview of the posterior superficial muscles of the leg. You can see a bunch of them here. All right, here we have the adductor magnus. So obviously it's going to adduct, so bring in towards the body. It is triangular shaped and is found on the medial and posterior thigh. It is partially covered, as you can see in the picture, by the gracilis, which remember is that very long, thin, slender, graceful-like muscle. It has a broad insertion on the femur and it inserts through what we call the adductor hiatus. This allows vessels and nerves to pass through from the anterior thigh to the popliteal space, and it's going to adduct and medially rotate the hip. All right, so here we can see the superficial muscles of the anterior medial upper thigh here, the leg, and this one is comparing to actual human anatomy from the superficial viewpoint. Here are the color coordinated diagrams, and I think these are great to actually take and draw these out. And with these colors, I think it's very helpful, okay? So we've got the superficial on the left of the anterior medial thigh. You can notice the sartorius here, if you look on the right, kind of makes it a little S shape. And again, another look at a cadaver and a model here for comparison's sake. All right, the posterior hip muscles include the gluteal muscles as well as the deep rotators of the femur, of the thigh, sorry. The gluteal muscles originate on the pelvis and insert into the lateral aspect of the femur. All of these abduct and rotate the thigh. The direction will rotate depending on the specific origin and insertion of each muscle. All right, here we have the gluteus maximus. This is the largest and most superficial of the gluteal muscles, and pretty much the only one most people really realize we have. We also have gluteus medius and gluteus minimus. This performs several actions: the extension, adduction, and lateral rotation of the thigh. The origin is the posterior ilium, sacrum, and coccyx, and the assertion is going to be on the lateral femur and iliotibial, I always have a hard time saying that, tract. All right, so now we have the gluteus medius, and it says medius, so it must be in the middle, right? So this is going to be superior to the gluteus maximus and inferior to the, superior to the gluteus minimus, inferior to the gluteus maximus. It will partially be covered by the gluteus maximus. So on the cadaver, you can pull that off to see this. Not completely pull it off, no, don't tear it up, but you can pull it up. So the origin is going to be the upper lateral surface of the ilium, and the insertion is the greater trochanter of the femur. All right, so the gluteus minimus, minimi meaning smallest, is the smallest and deepest of the gluteal muscles. You pull aside the gluteus medius and then you can see this one. The origin is the posterior ilium and insertion is the greater trochanter of the femur. And if I remember correctly, we're not going to really be able to see this very well. It's kind of hard to see. You can, it's kind of under that gluteus medius, but you're not really going to be able to pull that aside. Next, we have the piriformis, and it is pyramidal or triangular shaped, inferior to the gluteus medius. The origin is on the anterior lateral sacrum. The insertion, greater trochanter of the femur, and the action is abduction and lateral rotation of the thigh. It's actually a little easier to see on the solid model here down at the bottom. All right, so we're going to move on down to the muscles of the lower body. So here we have the hamstring group, the biceps femoris, semitendinosus, and semimembranous. Be sure to pay attention to which side of the leg you are looking at, or you will mix them up, okay? So notice that the semitendinosus is going to be towards the lateral side of the leg. The biceps femoris is going to be in the middle or more towards the inner thigh, and the semimembranous is smaller and is going to be definitely towards the inner thigh. All right, so here's another look at the hamstring group. We have the semitendinosus, biceps femoris, which has a long head and a short head, which we can see in this picture here. And these are located on the posterior thigh. They all have similar origin and insertions and actions. All hamstrings will extend, which means to draw posteriorly the thigh, and flex the knee, which means to bend the knee. All right, so here we have the semimembranous. This is on the posterior thigh. It is deep to the semitendinosus. You can see a small area of it on each side, basically, of the semitendinosus. By pulling the semitendinosus aside, you can see it. It's larger and wider than the semitendinosus, so it doesn't really look like it. It looks tiny because you're only seeing part of it. So the origin is the ischial tuberosity. The insertion is the posterior medial condyle of the tibia, and the action is to extend or pull posteriorly or backwards and flex or bend the knee. All right, so here we have the semitendinosus. Here we go. And this is going to be superficial to the semimembranous, and it's located on the medial side of the posterior thigh. So again, you need to be very careful. Pay attention to which leg you are looking at. Is it anterior? Well, obviously it's going to be posterior. Which leg you're looking at, and where is the medial side. So pay close attention to that, okay? This crosses two joints, and it can cause movement at two joints, extending the thigh and flexing the knee. All right, so here we have the biceps femoris. This is a large muscle on the lateral side of the posterior thigh. It has two heads, hence the word bi and biceps. It has a long head and a short head, and these originate from the ischial tuberosity and the linea aspera of the femur. The action here is to extend the thigh, which means to pull it posteriorly, and flex the knee, okay, which is bend the knee. So this assists in lateral rotation of the thigh. So here we have the sartorius, which runs kind of diagonally across the leg, and you can see it kind of has a little S shape there at the bottom. It is a strap-like muscle. It is the longest muscle in the body, and this helps us to sit scissor-legged or cross-legged. You can see here the sartorius. The origin is going to be on the anterior superior iliac spine, and the insertion is on the medial side of the tibial tuberosity. All right, here we have the gracilis. This is a superficial, very thin strap-like muscle located on the medial thigh. It adducts the thigh. I tend to think of the word graceful because it's a long, thin, slender, and we think of ballerinas. They're graceful, they're long, thin, and slender. So it adducts the thigh. The origin is going to be on the pubis and the ischial-ramus. The insertion is the medial aspect of the proximal portion of the tibia. And again, it's slender and graceful. So the quadriceps femoris group is made of four muscles. We have the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. All right, so here we have the rectus femoris. It extends the leg, does flexion of the thigh. The origin is on the anterior inferior iliac spine, insertion patella. So the rectus femoris is lateral to the vastus medialis. It runs straight down the anterior portion of the thigh, and rectus means straight. This is the only quadriceps muscle which crosses both the hip and the knee, and so it can cause movement in both of those joints. The origin, anterior, inferior, iliac spine, and I already said insertion is patella. Vastus lateralis, this is the most lateral of the quadriceps. It extends the knee. The origin is the greater trochanter. Insertion is the quadriceps tendon. It will extend or straighten the knee. The common site of injection, this is where we would give an injection if we're looking at the thigh, because there's no large nerves or muscles to injure here. All right, so here we have the vastus medialis. This is the most medial of the quadriceps muscles. The origin is between the greater and lesser trochanter of the linea aspera on the femur. The insertion is the quadriceps tendon, and the action is going to be to extend the knee, which is to straighten it out. All right, that's it on that one. So if you pull the vastus lateralis to the side, you can see this particular muscle we have here. This is the vastus intermedius. This is going to be deep to the rectus femoris between the vastus medialis and vastus lateralis, so hence the word intermedius. So to see it, you got to pull that rectus femoris aside. It is going to help extend the knee. The origin is on the anterior lateral portion of the proximal femur, and insertion is quadriceps tendon. So next we have the quadratus femoris. This is a very short rectangular muscle, most inferior of the deep rotator muscles, laterally rotates the thigh. The origin is the ischial tuberosity, insertion is the crest of the greater trochanter, and the action will be to laterally rotate the thigh. All right, so next we have the muscles of the lower leg. We have the gastrocnemius, cilius, plantaris, and popliteus. The lower leg has three sets of threes. We have three muscles on the posterior leg, three on the lateral leg, and three on the front of the leg. So the anterior and posterior group include the THD muscles, all right? And so these are the tibialis, hallucis, and digitorum. So you want to remember those and learn them in a group. The lateral three muscles are all fibularis muscles, and that's going to be fibularis longus, brevis, and tertius, or tertius. All right, so my arrow is a little backwards here. This is the gastrocnemius. It is what we think of as our calf muscle. It is superficial, and it is on the posterior aspect of the leg. It has an origin of the medial and lateral condyle of the femur. The insertion is going to be on the posterior calcaneus, and that is going to be via the Achilles tendon. So the action is flexion of the knee, which means bringing the knee back, plantar flexion of the ankle, so plant down towards the ground. All right, so here we have the soleus. This is deep and inferior to the gastrocnemius. It is a broad, flat muscle. To view, you gotta kind of pull the gastrocnemius aside and to really get a good look at it. Origin is on the head of the fibula and proximal tibia, and insertion is the back or the posterior side of the calcaneus. All right, so here is THD, the three deep muscles of the posterior leg: tibialis posterior, flexor hallucis, and flexor digitorum. So the tibialis posterior is the longest of the muscles and the middle of the three. The flexor hallucis, remember I said hallux is your big toe, is going to be the more lateral muscles, and so it's going to extend on towards the big toe. You'll likely follow a tendon there, right? And then flexor digitorum, well, where do you think that goes? Obviously to the digits, and this is going to be the most medial of the three. All right, here we have the flexor digitorum longus. This is located on the posterior medial aspect of the tibia, deep to the soleus. It is the most medial of the posterior deeper muscles. The tendon splits into several branches and travels under the foot towards the tarsals and phalanges. So follow the tendon under the foot. It's going to go onto the toes, of course, so you're going to follow it to those digits, and it's going to flex toes 2 through 5. Also participates in plantar flexion of the foot and inversion of the foot. All right, the tibialis posterior here. This is a thick, flat muscle deep to the soleus, lateral to the flexor digitorum longus. Find the flexor digitorum, which is the most medial deep muscle, and the tibialis posterior, and this will be just lateral to it. It's going to travel posterior to the medial malleolus on the tibia. This is the longest of the deep posterior leg muscles, and the action is plantar flexion of the ankle and inversion of the foot. All right, so here we have the flexor hallucis longus, and so this is going to go to the hallux, or the big toe. This is the muscle that we use to push off during walking and running. The great toe is also another name for the hallux or big toe. It is lateral to the tibialis posterior, which is the little toe side of the leg, and it originates mid-shaft of the fibula. It's going to travel diagonally towards the big toe. It is shorter than the other posterior calf muscles. You can follow the tendon as it travels from the fibula to the great toe. All right, origin on the midshaft of the fibula, insertion under the foot to the distal phalanx. All right, so next here we've got the popliteus. This is a small triangular muscle at the back of the knee. Popliteal means the back of the knee. The origin is on the lateral condyle of the femur and the meniscus of the knee. Insertion is proximal medial tibia, and this is going to unlock the extended knee to allow flexion. All right, the anterior leg muscles are going to dorsiflex the foot, which means move upward at the ankle, or extend the toes, which is move the toes upward. These are going to all originate on the tibia and insert onto the top of the foot, the tarsals, the metatarsals, or the phalanges. The muscles of the medial and lateral lower leg are here. You can see these pretty well. All right, so next here we have the tibialis anterior. This is on the anterior lateral surface of the tibia. It's a more elongated muscle. It's the most anterior of the leg muscles. So follow the tendon to the medial aspect of the foot, and the origin is going to be on the lateral condyle of the tibia and the tibial shaft. All right, so here we have the extensor digitorum longus. This lies between the tibialis anterior, and the fibularis. This is easily identified by the branches of the tendon traveling to the toes. It travels along the lateral anterior of the surface and the lower leg, and you can see here it goes through the digits 2 through 5. All right, so here we have the fibularis, longus, brevis, and tertius. I don't have great pictures for these. The fibularis longus, typo there, is in green. The brevis is there in purple, and the tertius is in bright yellow. All right, so here you can see the fibularis longus. This overlies the fibula on the lateral side of the lower leg. The tendons of the longus and brevis run just posterior to the lateral malleolus to the bottom of the foot. The fibularis tertis tendon travels along the top of the foot down towards the fifth metatarsal, which is the little toe side. All right, so here we have the deeper muscles of the lateral and anterior lower left leg. You can see how these all relate to each other really well in this picture.